Well, this was the announcement in the newspaper 2 days after Christmas in 1901 under an all-caps headline, Vaccination in Boston. Quote, notwithstanding the fact that some 400,000 people have been vaccinated in Boston since January the 1st, the Board of Health ordered that all the inhabitants of this city be vaccinated or revaccinated forthwith. The board explains that although there has been a most remarkable cooperation throughout the city, the medical profession and the people in general having acquiesced to a most remarkable extent in its request for vaccination, it is necessary in order to stamp out the smallpox epidemic that all persons not protected by vaccination or revaccination shall be vaccinated, end quote. Now, this was about the deadly Boston smallpox epidemic of 1901. It killed hundreds of people. It would also turn out to be Boston's very last smallpox outbreak, because if cases kept climbing, despite pretty high vaccination rates, the health department mandated that everyone in Boston get a vaccine. Doctors went door to door with vaccines. Look at this amazing illustration from the Boston Globe. This is January 28, 1902, so about a month after the health department announced the mandate. Quote, about 10,000 vaccinated in South Boston. Board of Health had 115 physicians at work. And below that, it illustrates what each of these doctors carried with them: cotton, alcohol, and, quote, several boxes of vaccine points. The boxes probably looked something like this. Smallpox vaccine was administered at the time using a point made of ivory or bone with a little bit of the virus on the end. Doctors went house to house vaccinating people, as illustrated by the Boston Globe. Here's one woman getting the vaccine, surrounded by her small children. The caption reads, "Protecting Mama." Anyone who refused a vaccine would be fined $5. That's equivalent to about $150 today. And you see part of the headline on that illustration. The Board of Health, quote, intends to bring those who refuse into court. That's exactly what ended up happening. A local pastor named Henning Jacobson refused to be vaccinated. He refused to pay the $5 fine. He took his case all the way to the Supreme Court of the United States, and he lost. In its opinion, the Supreme Court wrote, quote, there is, of course, a sphere within which the individual may assert the supremacy of his own will and rightfully dispute the authority of any human government, especially of any free government existing under a written constitution. But it is equally true that in every well-ordered society, the duty of conserving the safety of its members, the rights of the individual in respect to his liberty, may at times, under the pressure of great dangers, be subjected to such restraint to be enforced by reasonable regulations as the safety of the general public may demand. Well, the Boston smallpox epidemic produced a vital legal precedent about what the government is allowed to do in the name of public health. And also, the vaccine mandate in Boston worked. You can see from this chart that smallpox cases in Boston peaked in December of 1901. At the end of that month, the health department announced the vaccine mandate, and from there, cases came steadily down from their peak until the very last few cases were documented in the spring of 1903. Now, it bears mentioning that Boston's response to the smallpox epidemic and the Supreme Court ruling upholding it were far from perfect. Public health authorities in Boston, for instance, vaccinated people forcibly in some cases, especially in immigrant and disadvantaged communities. And there had to be further judicial intervention to clarify that that was not acceptable. The Supreme Court decision upholding public health mandates was later used to defend things like forced sterilization. Medical ethics and American law are always evolving, and hopefully we get better at this stuff over time. I mean, just to be clear, no matter what your uncle who watches Fox News is telling you, no one from the federal government is coming to your house to force a COVID vaccine onto you or into you. But the fundamental lesson of that Boston smallpox epidemic still stands, both in American law and in our general sense of what we owe to each other as members of a shared society. The government can take reasonable steps to require people to get vaccinated against a virus that threatens the health and safety of our fellow citizens. Well, today, President Biden announced that all federal workers and contractors will be required to get a COVID vaccine, or they will have to undergo regular testing, wear masks at all times, socially distance, and be prohibited from traveling for work. Biden also said that the Defense Department, the world's largest employer, will look into how and when the COVID vaccine should be required for all service members. And the president announced new paid time off for employees and their family to get vaccinated. He also encouraged states to start offering a $100 incentive for unvaccinated people to get the vaccine.
Nearly all of the cases, hospitalizations, and deaths due to COVID-19 today are from unvaccinated people. Last month, a study showed that over 99% of COVID-19 deaths have been among the unvaccinated. 99%. This is an American tragedy. People are dying and will die who don't have to die. If you're out there unvaccinated, you don't have to die. Read the news. You'll see stories about unvaccinated patients in hospitals. As they're lying in bed dying from COVID-19, they're asking, "Doc, can I get the vaccine?" And the doctors have to say, "Sorry, it's too late." Right now, too many people are dying, or watching someone they love dying and saying, "If I just got vaccinated, if I just." It's heartbreaking. And it's complicated even more because it's preventable.
Step today announcing a vaccine mandate for federal employees and contractors, and the federal government employs a lot of people. So this order will have an impact just in terms of raw numbers. But it's worth hearing something that the president said after his prepared remarks, answering a question from the press.
Why not push for vaccine mandates in states, private companies, schools? Do you want to see those entities pass vaccine mandates?
Well, I'd like to see them continue to move in that direction, and that's why I pointed out. I had asked the Justice Department to determine whether they're able to do that legally, and they can. Local communities can do that. Local businesses can do that. It's still a question whether the federal government can mandate the whole country. I don't know that yet.
So first of all, the president there appearing to leave the door open for a national vaccine mandate at some point, which seems like a big deal. But also he says he's hoping that private entities will follow his lead, that more places will start requiring vaccines. And some of the country's most high-profile companies have already started to follow suit. Google, Facebook and Twitter, Delta Airlines, Netflix, Morgan Stanley, Saks Fifth Avenue, The Washington Post, Uber, and Lyft. They're all instituting vaccine requirements when their employees return to the office. The state of California, New York State, New York City, they've all rolled out vaccination requirements for government workers. Meanwhile, there is new evidence that the spread of Delta, the Delta variant, and the rise in cases and hospitalizations and deaths may itself be spurring more people to get vaccinated. Yesterday, 500,000 Americans got their first vaccine shot. That's the highest daily number in all of July. And the states with the highest case rates have seen an uptick in their vaccination rates in the past week. But vaccines are still not getting into arms fast enough. Today, for the first time, the European Union pulled ahead of the United States in its vaccination numbers. Europe has now gotten doses to a higher percentage of its population than America has, which is remarkable when you consider that the United States has had way more vaccine doses for way longer than the European Union. But here we are, with the World Health Organization reporting that the United States had the highest number of new COVID cases in the world last week. And now, new worrying news breaking just tonight. The Washington Post has obtained an internal CDC document that says the Delta variant of COVID-19 not only spreads much more easily than other variants, but may cause more severe illness as well. The Post writes tonight, quote, "The document is an internal Centers for Disease Control and Prevention slide presentation shared within the CDC. The document strikes an urgent note, revealing that the agency knows it must revamp its public messaging to emphasize vaccination as the best defense against a variant so contagious that it acts almost like a different novel virus, leaping from target to target more swiftly than Ebola or the common cold." It cites a combination of recently obtained, still unpublished data from outbreak investigations and outside studies showing that vaccinated individuals infected with Delta may be able to transmit the virus as easily as those who are unvaccinated, end quote. The Post reports that this still unpublished data was behind the CDC's decision to change mask guidance this week, calling for masking indoors in certain public settings, even for vaccinated people. But the CDC still has not made this data public. Here's one slide from the CDC presentation published by the Post tonight. It summarizes the findings on the Delta variant this way, quote, Delta is different from previous strains, highly contagious, likely more severe, breakthrough infections may be as transmissible as unvaccinated cases. Another slide says, quote, universal masking is essential to reduce transmission of the Delta variant. And on a slide titled Next Steps for CDC, it says, quote, acknowledge the war has changed.